All right, welcome, welcome. So you are in for a treat, viewers, because we're going to be talking about that. We're going to be talking about pain and how it impacts our relationships, particularly intimate relationships. Listen, get ready for the deep dive because I am here with my colleague and friend, Dr. Zeudiann Coleman. She is a chiropractor at Z Chiromed Spa. If you want to treat yourself, if you're in pain, if you've had a car accident and you need some work, she's the person to call on. So we are going to be talking to you about how pain can affect relationships. So, Dr. Z, how are you today?
I am doing wonderful, wonderful, Dr. Sharon. Thank you so much for creating this collaboration. I think this is like the perfect thing to bring together, not only your emotional pain, but the physical pain and how they come together. And I can't wait to deep dive into that because there's some very important nuggets that we could use every day in our everyday life or with our partners, etc., that could make life even more interesting and fun and sexy and all that, right?
That's right, of course. I know we have pain, but
Right.
life doesn't stop. You can't stop being intimate all together with your partner. There are creative ways to go get around it. So
Yeah.
I just kind of wanted for the viewers to understand the difference between acute pain and chronic pain, and then you could help me out. So, acute pain is sudden and it lasts for a couple of months, but chronic pain is about 6 months and longer. And so I think the trouble in relationships, or the challenges, not the trouble, but the challenges when it comes to doing certain things when you're in a relationship and or have a family is the chronic pain that lasts longer than 6 months. People start to get frustrated and individually, this is when anxiety and depression and guilt can start to set in. What do you think, Dr. Z?
Absolutely. So, like you said, when that pain sticks around more than a month or two, or even three, we're getting into what we call chronic pain.
Mm,
And, I would say in statistics in the United States, about 80% of Americans have experienced some form of chronic pain and is actively looking for um, ways to manage that because it does affect their daily activity. And so one of our daily activities is sex, right?
that's for some people.
Right.
We're
Well,
not everybody. but
listen, if
I
we
don't know
didn't
what you
have,
be doing.
look, it is part of life. God made it there for a reason. It does keep us healthy and vibrant. And it is something that helps to keep people connected, especially when you're in a long-term relationship.
Yeah.
So I find like people are more, they're like, you know what, I want to get out of pain because I want to be able to go to work and have a better quality of life,
Yes.
to be able to play with my grandchildren or travel. They don't necessarily talk about the sex part.
Right.
And that is like the big elephant in the room that nobody wants to talk about.
Yeah.
So I'm bringing it out because nobody wants to talk about it. I'm sure it is affecting their, daily activities
Yeah.
and their partnership and their connection with their partners. So, I think as a chiropractor, a holistic chiropractor, and connecting with you as a relationship wellness practitioner, we can definitely unfold some things that we can do. And just I have a great gift for those who are interested in deep diving more and healing those parts of their daily activities.
So I just want to clear so the viewers don't think that we're confusing. I said chronic pain was longer than 6 months. You say chronic pain is about 3 months, and so can we meet in the middle here? what do you say? You say chronic pain is 6 months and acute pain is a couple of weeks?
Well, it may be different for different people. As you get older, it takes you a longer time to heal. If you're diabetic, those
True,
parameters fall into place. So I don't like to keep it so rigid,
rigid.
but it
True,
also
true.
depends on the person.
Yeah,
For me, if you're healthy, your stem cells are kicking in,
yeah.
you're eating healthy, you're hydrated, all that, you should really be healed in 4 weeks.
Mm,
You should be out of acute care in 4 weeks.
okay.
If you're moving beyond that, 4 weeks is a month, so if you're moving beyond that, 3 months, yeah, it's not
So
going
does it
away.
also depend on the injury or is that
Also depends
same?
on the injury, also
Yeah,
depends on, a lot of different factors. So, I mean, textbook, yeah, they might say, the six
6 months.
months.
Yeah.
It's definitely in that phase.
Okay.
But for me, as a wellness doctor and preventive care doctor, I want to get things in the early phases.
That's right.
I don't want to wait till it's 6 months in and you've got all this other things set up. The body has created different pathways, negative, bad pathways to
Yeah.
deal with the pain.
Yeah.
So we want to, because of the rehab that I do, I like to get into those spaces quicker
Yeah.
than
That
later.
makes sense. Yeah, I like that. And I think that is very clear. It does have variables depending on the individual, the pain.
Yeah.
But I like the fact that you said that as a holistic practitioner, we're looking at 4 weeks, 4 to 6 weeks for the pain to be zero. If we're
Yeah.
talking about a pain scale from
Yeah.
1 to 10, we want it to be zero as
Mhm.
quickly as possible.
Yeah.
And the other thing that I like is that a lot of people and a lot of practitioners may not recognize the quality of life. As
Hmm.
you said, that intimacy is about quality of life too, because if you can't
Right.
hug your partner, you can't hold on your partner, you can't get in certain positions, your favorite positions, all of
Right.
that starts to affect the emotions. And
Yes.
so now you want to be careful because now there may be emotional distance
Hmm.
because of fear, and then of course guilt, and
Hmm.
then a lot of and then when we think of these have these negative thoughts, we create even more distance and frustration. That frustration we then take out and project on our partner. So and then when we project it on our partner gets upset, and then if you have children, then you're not happy, the children are not happy because you can't do what you usually do, even cleaning up the house and doing chores and asking your partner to help you out and support you in those areas, it can take a toll on both of you. So I think that this is a
Absolutely.
real important subject, particularly from the chiropractic point of view, and then also juxtaposing that with the relationship and emotional healing, because it is a part of emotional healing. Because even when you have your clients, Dr. Z, your patients, when you pass them on to me, I have to talk about how they're feeling and what are they doing to energize themselves. What are they doing else? What else are they doing to help with that healing and the
Hmm.
breathing parts of it, and the support? I'm always asking, what type of support do you have? So all of those things are interconnected.
Absolutely. And, sometimes when we have depression and all these other emotional things in the sauce, we and I'm just gonna speak for myself. Sometimes my pain, I put it I don't want to put it up front. I try to deal with it myself, camouflage it maybe with saying it will go away soon, that kind of stuff. And not knowing that the way I'm behaving or the way the other person might be behaving, maybe because they're in pain. The way a patient could be behaving when they first come in to see me, I know a lot of it has to do with the fact that they're dealing with discomfort and pain. And it is like that silent thief in the bedroom with most couples because it's stealing that intimacy, it's stealing the connection. It's like the other partner in the bed that's separating the two people, and nobody's talking about it, and it's almost like one person maybe is thinking, oh, maybe that maybe my partner doesn't think because I have back pain, that I'm useful enough, or I can still be, you know, able to make them feel well, feel good, or just even like hugging and all that. Maybe, and then maybe the other partner is saying, you know, she seems so fragile. I don't
Yeah.
want to do anything.
To
I
hurt.
make her hurt more.
Yeah.
And, you know, and they're having these two different conversations in their head,
Yeah.
and it's that silent partner in between, you know, just visualize that. The
Yeah.
big elephant,
Absolutely.
the big
Yeah.
elephant sitting right between them. Nobody's communicating, and they're all thinking two different things. If they just learn how to communicate with each
Mm.
other, maybe like you said, be able to you know, get support from other places that will help them to have those conversations, and some of the tips which, you know, I actually portrayed in my book, um, how to create that connection,
Mm-hmm.
even with, you know, and kick that elephant out of the room.
Yeah. You know, and I was just thinking, Dr. Z, that many people may not think that they could go to their chiro and ask them what positions or what ways will help if they decide to become intimate, how, you know, so they're not hurting themselves more. And I think you said the key thing here when you're in chronic pain,
Mhm.
that we have to educate ourselves. And we
Absolutely.
have to be able, and that will gear the communication, the conversation, as I like to say, have a meaningful conversation, because we know how to communicate, but do we know how to have a meaningful conversation? So once we
Right.
educate ourselves about the pain, about where the pain is, how it can impact, and what things we need to do to help it, once we educate and communicate, then we're on a better path. And then also, I'm sure that you agree that self care, maintaining
Mhm.
the
Mhm.
self care, making sure I sometimes I laugh. I hope your patients won't get mad at me, but sometimes I laugh. And when you say, "Are you doing the exercises?" Like, I did it once, or
Right.
maybe I've done it twice, and it's
Gotta
like
be consistent.
we have to be consistent,
Yeah.
and I call that as part of self-care, restorative care, and
Mhm.
adopting even healthier habits. So that
Yeah.
really has a lot to do with, and then also having some compassion for yourself, having
Yeah.
some grace for yourself is also very important. And if anything, even though you may not cognitively think it, but when we can't do what we usually do, we have guilt. So I say release the guilt, you know, release the
Release
guilt.
it. You
Yes.
can't, you know, release it. You know, like my mom would say, don't go to bed upset. You got to release that, you know, open that communication. And, you know, I just love the fact that you're bringing up a lot of things that I actually touch on in my book, Heal Your Back, Ignite Your Sex Life.
Hey, you
Um,
better get it.
Heal your back, ignite your sex life.
Yeah.
It is an accumulation of my years of experience in helping individuals overcome, you know, back pain, whether it's a sudden situation from a car accident, or whether it's something that is occurring over time from their work, their job, you
Yeah.
know, just maybe motherhood,
Yeah.
etc. And you know, you're right. There sometimes they don't think that they can have that conversation, but one of the questions that I do ask when I'm doing my exam and, you know, getting to know them kind of thing is, what is it that aggravates it?
Mm.
When did it start? What
Yeah.
happened? Do you remember the episode when when it started?
Yeah.
And, you know, sometimes as doctors, we need to spend more time with our patients, get in the background of what's going on in their life, how things are starting. So, you know, we don't just always run for the band-aid, you know, a pill here, a pill there,
Yeah.
so that we can tap into what it is that caused it, or that's aggravating it or creating the flare-ups, so we can nip those out of the butt
Yeah.
and maybe figure out, okay, maybe it's a weak muscle, maybe it's a you know, bad positioning, maybe, you know, all those things. You get those answers when you get more information from,
Yeah.
the clients about how, you know, their life's been affected. And you know, I find that women are more open to tell me about, you know, if their sex life is affected by back pain.
Yeah.
And And in fact, we'll be the one that will just go through the pain, even in those cases. And I think it affects both partners, equally. Because, as far as a man, when he has chronic back pain, it affects his ability to be erect and also
Wow.
a
Yeah.
lot of other things.
Yeah. Yeah.
So, but they're tight-lipped about that a lot of times.
Yeah. Pride.
And yeah, and they're the ones that you'd see the wife is pushing him through the door to get help and to get, manage that pain properly and not keep it all in and
Yeah.
all that. So, it would be great to have that great open conversation
Yeah.
in the clinical setting so that we can get to those nitty-gritties.
Yeah.
Um, yeah, so definitely addressing chronic pain. Um, it does affect us emotionally, as you were saying before, and
Yeah.
you're the expert in that area.
So yeah, I do have a couple of clients who come to me because the partner is complaining that things have decreased,
Hmm.
and I find that really educating and allowing having the partner come is so important so that they
Yeah.
could ask the questions and the couple feel very comfortable airing out how they feel. But we can't stress enough educating yourself and communicating, having those meaningful conversations. But as we talk about it on the emotional side, I got to go to the energy thing. That's my thing.
Yeah.
So, two things. You had said that sometimes we don't recognize that the pain is in the muscle or whether it's in the bone. And oftentimes you could have had a prior injury
Mm-hmm.
in that particular part. And so now the body remembers that, and now the fear comes in. And so they don't work as hard or they don't put the pressure on that side. And then I know that that's how some instability or imbalance comes around because we are afraid to re-injure that part.
Yeah, I think I call it like you babying, especially when you've had trauma in a certain place
Yeah,
and you tend to baby it, even though it's healed and moved
yeah,
on.
yeah,
And also during the time of healing, we probably develop different patterns of doing things, and then we carry that even in the heal stage. We didn't let it go.
yeah,
For instance, someone who uh I'm going to bring it back to the relationship part, like someone who may have had a car accident and now they have this pain and they may have uh said, we can't do this kind of intimate stuff right now because I'm having back pain and so and so and so, and they've been going to the chiropractor, they get better, but they're still carrying on the same,
yeah,
I don't know if I can do this, and
yeah,
so they don't go back to reclaiming what they had before. They
yeah.
just keep carrying the idea that they still have pain. And sometimes, almost recreating and manifesting the pain all over again.
Absolutely. So that's exactly where I was getting at, because if we keep that in our mind and we bring attention to that pain, then
Hmm.
physiologically we bring it back. And
Yeah.
so some of the things that we can do is the breath work, is the meditation, is
Hmm.
also scanning the body. I'm a big advocate for scanning the body, and I believe in talking to the body. You can
Hmm.
tell the body to heal. You can put your energy towards that part of the body, and that also is a complement to what you're doing with your other providers,
Hmm.
particularly your chiro. So it's really important that you do the work so that you could get back to doing the do and
Yes.
having that really quality of life. But I
Yeah.
think it's so much so of how we're thinking about it. And when you have any type of, people may not think of it, but when you do have some type of injury or back pain or, excuse me, a pain anywhere in the body, as we're talking about the musculoskeletal system,
Hmm.
we, I cough like my trend of thought. We tend to not ask the questions and not continue with the protocol. So I believe in that we need to make sure that we have a routine and that we really get your support team and educate your support team. You need to educate and have a circle of support when it's
Yeah.
particularly when it's going into chronic pain. So it may not be just your partner, but it may also be your children and any other
Mhm.
immediate family and or friends so that they can help you get better. Because even though we're talking particularly with partnerships that live together, you still have relationships with other family members.
Yeah.
And
Yeah.
so even if you don't live with a intimate partner, you may live with a parent or another caregiver, or you have children. They still need to be educated on what you need to help to heal yourself. So relationships are not just one-sided; they're both-sided, and everyone needs to be able to know exactly how and why you're going through that. And once the doctor clears you, then this is where the real healing begins in your mind.
I was about to say that as a chiropractor, we don't even take the credit that we're healing you because it is the innate inside of you that
Yeah,
actually heals you. So once you have um, you know, accepted the healing art that we've given you, as far as doing our chiropractic work, the breath work, the counseling and so forth. You're the one who's going to create the most impact in your healing,
yeah,
because you have to make that decision in your mind and change the narrative in your brain, that you know um, I'm going to be healed. I'm going to get a beautiful relationship back. I'm going to stay intimate with my partner, and all the different layers of support that I have is going to be there for me, and they're there for those are the things that you have to play out in your mind
yeah,
and meditate on, because it is really, healing is a mind body
yeah,
situation,
yeah,
and the doctor is just there to remove the
yeah.
interference, and that's how we operate. That's how I
I
was taught
love that. They are there to
as a
heal the
practitioner.
interference. I love that.
Remove the interference.
I
Yeah.
love that. Absolutely. And so,
Yeah.
yeah, I believe that we do heal ourselves. And I just have to put in a shameless plug here. Of
Hmm.
course, if you feel as though that you can't handle it on your own, there's always hypnotherapy. As a
Well,
hypnotherapist, I teach you self-hypnosis so that you can learn to have the techniques that when you're in that chronic pain, that you can begin to heal yourself that way. And hypnosis is evidence-based. It is proven the fact that if you use these techniques, you can begin to decrease the intensity of the pain. So using that as a complement to seeing your chiropractor and provider, that this is a
mhm.
wonderful, it's a wonderful marriage. And so
Yeah.
don't shy away from that, because hypnotists are in the hospitals, they're in the skilled nursing facilities, they're in hospice, they're in the cancer treatment centers. So the practice of the technique can be very helpful too. And your partner can definitely join in and support you that way too.
Yeah, I definitely think that more people need to be more open-minded to that. Like we were talking about this mind-body connection, right?
Yeah,
And how when the body is in pain, the brain is constantly receiving these signals of distress. So that affects your mood, that affects your energy level, that affects your self-esteem. So
yeah,
it definitely, affects who you are. So if you had a modality like, the hypnotism, which I would love for you to explain to me how that art uses the mind body connection module to reduce pain.
yeah. It's so if I'm teaching self hypnosis, then I will go ahead and have the client visualize, really picture where a comfort level. So it may be when they were doing an activity where the pain was not present, where they're not thinking about the pain, and have them be put in that situation. And then what we do is go ahead and talk to the subconscious mind. And I give you different techniques on how you could really focus and concentrate and put that comfort into where that pain is. It sounds complicated, but it really is as easy as 1, 2, 3. It really is just visualizing yourself, putting it in that part of the body, and then doing that as a routine. It really speaks to it, because remember what you just said earlier is that in the brain you were talking about the neurons and how it connects, because okay, so now your body's saying, oh, you can't do this because you just hurt this, and when you do this you're going to feel pain. And so the longer you feel the pain, your body is now, your brain and those neuropath says, okay, don't go near there. Or when they go there, make sure that you feel the extra pain. Well, in hypnotherapy, we give the suggestion to the brain that every time that this happens, it is, you feel more comfortable. The pain is draining away. And so even though it may seem as though, oh, I'm just making an affirmation and can that really help? Well, it can really help, because you can talk yourself into negative situations and you can talk yourself into positive situations.
Yes.
We do that all the time, and we just don't call it hypnotism. So there are ways that, like I said, it's a complement to what your other providers are doing, and it is very, very effective. And so that's the simplest way that I can explain it. I do give self-hypnosis classes. Again, a shameless plug on Thursdays. On Thursday evenings, so just, hit me up if you want to learn some more about what that is. But I think, again, it's very effective for pain, and especially if it is interfering with your quality of life, particularly your sex life. And so bend down again and let us see the title of that book.
Absolutely.
Heal your back
and ignite your sex life.
So tell me some of your fun chapters that you wrote in that book.
Well, one of the chapters that I wanted to start off with introducing people to their spine, because it's in the back. It's not in front. It's not like their teeth, where it's going to make them look better and, have all that. And most people don't even, know what their spine does. They don't even know its main function. So what I did was I introduced people to their spine, give them a quick, fun way of understanding how it works. And there's a lot of visualization in this book, because it is actually more like stories that they can relate to. And so they can actually see themselves in these situations, or one or two of those situations, and find answers based on what the characters have done to to fix the problem. So there's stories that help you to rediscover that passion in the bedroom, that intimacy, even though you may say you have chronic pain. And so one of the first chapter I have there is a silent thief, which I talked about, how back pain sneaks into your life, and how to counteract that. And so, there's a story that explains how the character Emily, she understood the cause of her back pain, but how she counteracted. And you know what? You said something earlier that your brain really wants to protect you all the time, and sometimes there's some pathways that it's still in, saying that protect this area because it's going to hurt, protect this area, and that's how sometimes we're going to have to block those old pathways, recreate new ones, and tell your body that your body is healed. Now you can do this, now you can do that. And you'll see that your body will actually do those things.
It will listen to you. Absolutely, because that is self-hypnosis.
And I had look. I'm glad that you gave me that word, because really that is the definition of kind of one of the chapters. It's just not put as self-hypnosis, but I definitely, approve of that whole idea of getting a practitioner that can help you or teach you how to do that, because that could prevent you from taking a lot of medication.
Mm,
That could actually help you, move on with your life and start enjoying life a little bit more.
yeah,
And still, including your family and your friends and even your partner,
yeah,
because when you are in that block in that area there, it's affecting the family, it's affecting the person that's lying next to you, it's affecting the kids, it's affecting the extended families, your friends. So of course we want to get our life back,
yeah.
gain our life back. So the other at every chapter, really, there is a takeaway that helps us to, or help the reader to actually grab the key points out of the stories. And these key points are really like a manual how to deal with the situation. And, you may have to make some changes here and there based on your own situation, but it gives you some nutrients and food, and think how to move your body, and suggestions about how to boost your health, because that's a big part of it, and how to support your nervous system, not just with chiropractic,
Mm,
but with physiotherapy and massage and
mhm,
hypnotherapists, and even,
mhm.
a health coach like yourself. Those are all important to incorporate.
Absolutely.
Um, and one of the chapters that I enjoyed writing about was rebuilding intimacy in the face of pain.
Mm,
And just because we have in chronic pain doesn't mean that life is over. And sometimes when you what's the word? Even though, right? Even though you have the pain, you present yourself as, you know what? Today I'm going to go swimming, or today we're going to go and have, intimate dinner and so forth. Some of those activities actually help to reduce your stress and reduce your pain. So the act of doing it in spite of
yeah,
helps with the healing
yeah,
process.
yeah.
You don't want to wait for the pain to be gone for
Mhm,
you to be rebuilding that intimacy.
yeah,
Even through that, you just have to, like I said, um, communicate with your partner, get them to be less, because they're going through a whole thing too. They're like, I don't know what I can do. I don't know what I
mm,
shouldn't do.
yeah,
So you have that open. This is what feels good. This is what doesn't feel good,
yeah,
and just try different things
yeah,
that keep your body moving and
yeah,
keep the atmosphere light,
yeah.
and find new ways to do things that is fun and exciting. Before you know it, you forget you had pain.
Yes, that's how the brain works. You forget,
Before you know it, you forget you
oftentimes.
have pain.
Yeah. So yeah, I love that. And it's true. I don't know if you've ever had some pain, but and then it started to relieve, and
Yeah.
and then all of a sudden, you forgot that you even had the pain in the first place. So yeah, so
All that is all physiologically happening
happening.
inside. You're
Yeah,
releasing endorphins,
that's right.
that laugh, that tickle, that
Yeah,
whatever.
yeah.
And that's how the body deals with stress in certain
Stress.
ways. So
Yeah,
we just have to, stimulate those
yeah.
areas
Right.
to reduce stress and reduce the pain overall. So
Yes.
like I said, it's like in the book, it tells you, like, it shows how, the characters talk to each other. So
Yeah. It's
they
very
did that was,
practical. It's a fun book to read. It's a
yeah,
quick and easy book to read. The print
yeah,
is great. And so, it's something that it's part of your, if you collect self-help books, this is
hmm
definitely one.
yeah, that's
Don't have to
self-help.
be in pain right now in order to get the book. Like we
Right,
read about prevention. And
exactly.
if it happens, you already have your manual.
Not only that, you could probably help a friend out
That's
that has
right,
been
too. Of
talking to you
course.
about her
Yeah.
pain and discomfort and trying to get help. And you know what? You've read a book that could give her some tips, maybe even
Yeah.
refer her to the book herself,
Yeah.
and help them rekindle, their fire in the bedroom.
Absolutely. Yeah. I mean, because girlfriends talk, and if you got this book as a tip, that could make all the difference in the world. So absolutely, I
Yeah.
did want to touch just before we leave.
Yes.
I always have to talk about the energy and the emotional part. So even if you may have had an accident or an injury that really created the physical pain,
Mhm.
oftentimes it's bringing attention to maybe how what else is happening in your emotional body.
Mm.
And the emotional wound that is connected to your upper back pain could be something like you're not feeling supported,
Mm.
and you're feeling frustrated. As you see, the upper back is still part of the shoulders where we carry a lot of the burdens. So that's the emotional component. And so I also talk about that. Where's the pain is in the upper. So even though the chiro or your provider is helping you on the physical part, on the emotional part, you need to also take note that you want to feel supported and relieve some of that frustration, that stress. And so the middle, when you're having in the middle, pain in the middle of the back, it could also suggest that you may have some feeling of guilt, and maybe you don't feel self-supported because in
Mhm.
the middle of your back, remember also um, that's around your heart and your abdominal area. All
Mhm.
of those things are talking about support. That may be also where you feel very self-conscious. So
Yeah.
that is the emotional part, and also that whole middle section has to do with relationships, support, or are you feeling hurt by your relationship? So it's bringing attention to that, the middle
Mhm.
back or the upper back. And of course, the lower back now has to do with also, what should I say,
Probably unsupported or
unsupported.
yeah,
Yes.
just in a bigger form, you know.
Yeah. I was trying to remember, but it also has to do with relationships as well, but
Mm.
definitely, and frustrations, the lower back as well. Can't be, oh, that's what it is. I just remembered. Because with the lower back, how we bend. So are
Mhm.
you being flexible enough? Are you
Oh,
being
yes.
too stubborn?
Yeah.
It has to do with flexibility too, right? Because in the lower back, now it's getting really connected to around the hips and so forth. And this
Hmm.
is where we move. So, be mindful. What direction are you moving? Are you flexible enough? And so those are the emotional components to the particular injury as we are referring to the back. So that is also particularly
Interesting.
healing.
Flexibility for the lower back because
Yeah.
it is a pivot area. And, when you hold in all that emotional stuff, you're
Mm-hmm.
probably going to feel a lot of tension in those
Mm,
areas.
areas, yeah, and
Mm-hmm.
holding on to it. And so, like you said, the tension when we hurt, we tend to tense up,
Mm-hmm.
and then when we tense up, our muscles remember that, and so that's why we talk about breathing through it so you can relax the tension.
Mm-hmm.
And that's why Dr. Z will give the exercises also to promote the releasing of those tensions. But also,
Right.
I just wanted people to be mindful that there is when we have an injury, it also has an emotional wound as well. And so holistically, we have to add that in because
Mhm.
as the mind body connection, as you were saying. So yeah.
Absolutely. The emotional wellness, that was chapter 9
Mhm.
in my book, that emotional wellness, manage stress and anxiety. And it talked about, Lisa, she's 38 years old, a teacher, and how she was dealing with emotional stress and how she overcame it
Mm.
with some of the modalities that we were talking about, breathing exercises, and but first you gotta connect with the idea that that's the problem. You got
Yeah.
to identify that your emotional stress is making your pain even more. And,
Yeah.
um, one of the things that I noticed with a lot of us, even if we're not in pain, is that we're always in this flight fright flight mode all the time,
Yeah.
and we're releasing a lot of stress hormones like cortisol and adrenaline.
Yeah.
And these hormones actually are usually just meant for short-term crisis.
That's right.
So when that going and it's constant and it elevates. What that does, it increases muscle tension, inflammation, and sensitivity.
Yeah, that's right.
So learning to, cut that flight fright mode down to a minimum
Yeah,
will also help with reducing the extension of your pain
yeah,
into the point where it becomes, chronic.
yeah,
Like I was saying, when patients come to me after an accident, they're probably still in fright flight. You just
yeah,
had an accident, head-on collision,
yeah,
you're still
yeah,
going through your mind, you're still
yeah,
having dreams about what happened, you still
yeah.
haven't forgiven the other person who just messed up your, $100,000 car. All these things are going in your mind.
Okay, yeah.
You gotta deal with the lawyer, you gotta deal with the insurance
Insurance, oh
people.
my gosh, the insurance company.
It's like all that extends that
Yeah,
whole
yeah,
crisis mode, which should
yeah,
be a short term. And so my job when you come into the office is like, okay, this is where you're healing, this is where you're going to do you, this is where you're taking care of you now.
yeah, yeah,
You
yeah.
still, the ambiance is set, you got the music, you got the, aromatherapy. Yeah,
That's
you're in
right.
pain, but we still can set up the atmosphere to shorten those flight and fright mode where you're increasing your stress hormones and bring them down,
Yeah,
right? So that you can now get into more of a healing,
yeah,
rest and digest kind of mode so
yeah.
that your body can relax,
Yeah. And
release
so,
that tension.
when you say the word relax, I have to go back to hypnosis, right? Because this is
Yeah.
what we teach you to talk to the body to relax
Yeah,
and,
yeah,
and to rest. And so if you learn some of these techniques, you learn to relax because as long as we stay tense, the healing doesn't happen and you increase inflammation
mhm,
and you increase those hormones that are there to keep you aware that
mhm,
something happened. But
mhm,
I think it's really learning progressive muscle relaxation is
mhm,
another thing that really helps you through that pain. And it definitely helps you when you're in the bedroom just before, your honey lays
mhm.
next to you. You can do those progressive muscle relaxations and you'll see that it makes a big, big difference. And
Yes.
so we're
Yeah.
hoping that see your chiro, see your
Mhm.
hypnotherapist or your health coach. Read the book. All right, heal your back, ignite your sex life. We want you to have quality life, and when you're in pain, it does include being able to have some intimacy and having fun to create a balance. So even if you're in pain, of course, after you get out of the acute pain, we're not trying to tell you your doctor's going to say take it easy for a while. But
Yeah.
once you both are educated and knowing what things you can and cannot do, you can certainly ignite your sex life, and you can definitely heal your back. So tell a friend, tell a loved one, tell your family. This is a wonderful holiday gift.
Right.
We want you to feel whole. So thank you so much for the attention that you're giving us. If you have any comments, feel free to get in touch with us. Dr. Z, you want to, even though we're listed, do you want to tell them quickly?
I just have a word of wisdom.
Yes.
Now is the time.
Now is the
Now
time.
is the time to reclaim what's yours.
Hello.
Your health, your love,
Yes.
your intimacy, your passion, your boo. Reclaim what's yours.
All right.
Reclaim what's yours, your future. And every day is a new opportunity to write the next beautiful chapter in your life. And pain does not have to be there. You can rewrite those chapters and heal yourself through those chapters.
I love it.
You go ahead and we're going to list where you can find the book for purchase. We have a soft launch. Would love to get your opinion on it. Would love to see how you use it for yourself.
Yes.
And, absolutely, don't keep it a secret once it has blessed your life.
There you go. Thank you so much. So you've heard it here, Sharon B. Heart Lady at B. Heart Lady. And this is Dr. Z. Coleman on a Z
Right.
Pyro Med Spa. And you want to, do you have
Oh,
a
yeah.
media you
You
want
can
to
find me at CEO ceodrz.com, ceodrz.com, and you will have information about where to find my office and, you know, everything else, my e-card,
All right, then.
ceodrz.com.
All right, so y'all stay good, straighten up that back. I'm trying to, I look kind of lopsided, so it's not scoliosis, it's that my camera is kind of lopsided. Like people trying to switch to say that, okay, she's not leaning right, but that's it. Y'all have a good one. Take care.
All right, take care. Thank you so much.